So, today what we're going to do is we're going to talk about the Zerona Z6 laser. And this is a FDA proven non-invasive fat reduction. It is a cold laser. It is a red laser, just like the one that, similar to the ones that I have, only it's a lot bigger and stronger, and it is motorized and it spins. And I don't think I put a video in, I should have, but we'll do that next time. In any case, the first thing I wanted to do is I wanted to give you guys a little bit of a background of what this is all about. So first of all, Zirconia, you know, I have one of those, several PL5 cold lasers. I've had them since 2003. The company was actually founded in 1996. They were the first, this was the first low-level laser to gain FDA market clearance, and that happened in 2002. Since then, they have 17 of the 20 FDA clearances are to Zirconia. And Zirconia does a ton of research, and it's all level 1 research, which is expensive and hard to do. But it's the best kind, and so this is what their plant or part of their plant looks like anyways. And so this is in Melbourne in Florida, and it is made in the USA. So we're going to talk a little bit about science. And the reason that we're going to talk about science is because, you know, people want to say, well, why would Zirconia make a body sculpting laser? Their lasers that they were using were initially pain lasers. The red lasers, the purple laser, which has been around now also since I think 2004. The purple laser is great for any kind of skin or dermatome issues. If you guys hadn't seen the webinar that I did previously on Lasers for Life, you can go onto our website at sopcheckchiro.com, click on the video tab up at the top, and there's several different webinars that we've done on there, as well as the one called Can Taking Vitamins Kill You? All great webinars. They should all be somewhere in the half-hour range, and this one should be 20 minutes to a half hour as well. So anyways, why would you make a body sculpting laser? And the answer is it kind of happened by chance. But here's the thing. Obesity is a problem, and it's a health problem. And so it is okay, or makes sense to understand that that they would then further go ahead and try to do something in order to help enhance people's lives. And so people have said to me, you know, why, Dr. Bill, would you buy a body sculpting laser? What has that got to do with chiropractic? What's that got to do with my health? Why would you buy something like this? Well, it's simple. So first of all, I looked at these years ago, and I've been looking at them for probably about the last 5 years, and I finally decided that it's time to move on. The more I learned about it, the more I felt that the health benefits were there. Because you got to understand, when people don't feel good, they don't want to do anything. And if they feel better and they look better, then they're more interested in making better health choices. And besides, you know, in our mission statement, we say our mission is to enlighten, guide, motivate, love, and restore our patients to optimal physical, biochemical, and emotional wellness. Well, you know, here's the thing is physical, emotional, biochemical. We're going to talk about how all of these things are enhanced through using a laser. So we're going to stay tuned, and we're going to talk about this. And so this technology fits the bill in multiple different ways. Now, here's the thing. Obesity in the United States is a major health issue. We know that. The rates in the United States are among the highest. In fact, we're the second highest rate of anywhere. Mexico is the only one that beats us for obesity. Back in 1962, the country was stated that there was a 13% obesity rate. Well, now in 2018, just a year and a half ago, we're up to 39.8% of American adults. And the American Heart Association, that's according to the CDC. According to the American Heart Association, 1 in 3 kids are obese. That's crazy. Why does this happen? Well, we're going to talk about that in a second. But the thing is that, you know, this has increased by 300% in just 40 years. That's a huge increase, and it accounts for almost 400,000 deaths. So it's costing our society in people, it's costing our society in money. It's $117 billion is what they estimate that obesity costs us. That's both in direct and indirect costs. You know, direct meaning prevention, diagnostic, you know, treatment, all those kinds of things. And then indirect costs like loss of future earnings, premature death, absenteeism, and things like that. So why is America becoming overweight? According to the Cleveland Clinic, and I thought this was interesting, so I put it in there. According to the Cleveland Clinic, it's a cultural, social, and environmental factors. Okay, so the big deal is that, you know, people eat too many favorite foods, and these favorite foods are hamburgers, French fries, donuts, pasta, bread, rice, chips, crackers, bagels, muffins, cookies, crackers, cakes. I mean, this is all, we've become a sugar and a feed me now, I don't want to do anything later. Pardon the pun there, huh? Anyways, it's easy to make, okay? You deep fry stuff, you buy prepackaged stuff, you go to McDonald's and you pick up $1 burger. I mean, where are you gonna get a burger for $1? You can't even go to the grocery store. That should tell you that something's wrong with that burger, because not only are you paying $1 for the burger, but which has all the condiments and the bread and everything, but somebody has to make it. They have to pay in order to have their McDonald's or whatever it is, their place there. So is it really beef? And if it is, how much of it is? So they might say 100% beef, but how much of that burger is actually beef? Maybe that 100% is the tiny little portion that they call beef. Anyways, there's been an increase in obesity-related medical problems, including type 2 diabetes, high blood pressure, cardiovascular disease, and disability, okay? When we talk about these kinds of things, diabetes is the 7th leading cause of death in the United States. And there's some crazy numbers here. 57 million adults, okay, age 20 and older are pre-diabetic. 23.6 million are diabetic. And so it says that with 95% of the latter being type 2, meaning that 23.6 million people who are diabetic, most of those are not born that way, but it happens because of the garbage that we eat. If you actually do the math and think about this, I was thinking about it and I thought, okay, so we've got like 330 million people here in the United States. So if close to 80,000, or I'm sorry, if close to 80 million people are diabetic or pre-diabetic, that means that 40% of our population is pre-diabetic or diabetic. That's a big problem. And so when we think about obesity, we look at diabetes. Okay, so why do you get, how does diabetes come about? Well, it comes about because of bad and imbalanced diet, lack of exercise, you know, you get insulin resistant, and now we got diabetes. And again, I said it's risen 95% in the last 25 years, 300% in the last 40 years. Heart disease is the #1 cause of death. And guess what? Obesity is a leading risk factor. Cancer, another 20% of new cancers are contributed to obesity. Depression. So why depression? Well, because people, when there's obesity and they gain weight and they have issues, what happens is they get frustrated and then they get depressed because they can't lose weight, or because, you know, they can't stop eating, or because, you know, no matter how much they work out, maybe it's the hormones have been messed up. And speaking of hormones, reproduction research talks about how obesity reduces fertility rates and it increases miscarriages in pregnant women. Also remember that fat holds on to and makes actually estrogen. And so it makes you bigger and it makes you more hormony, if that's such a word. Respiratory disease, asthma, sleep apnea, obesity, hypoventilation syndrome. These are common things that you tend to see with people who are obese. And why is that? Because it's a lot more difficult to breathe, because there's adipose tissue or fat that's constricting the airways and putting pressure and stress on the lungs. And so it's harder to breathe. Neurologists found that there's a link between obesity and cognitive decline. So now we know that there's also memory issues and thinking skill problems when people become obese. Musculoskeletal, I mean, that makes sense. It's a leading cause of arthritic pain. Why? Because there's a lot more stress on the joints, especially the foot, the ankle, the knee, you know, even the shoulders, because if the arms are heavy, it puts a lot more stress. And so then a lot of times what happens is when they become morbidly obese, they stop moving around. And when you stop moving around, what happens to your muscles? Your muscles start to atrophy and they start to break down. Medical care. Medical care of obese patients actually is estimated to be 36 to 150% higher than for non-obese. And you sit there and go, well, why is that? Because it takes more to do more. You know, takes more medication. than somebody who's not, because there's a lot more to go through. And when I say go through, I mean there's a lot more tissue that absorbs it and reduces the effectiveness of it. Companies in the United States with a bunch of employees, like over 1,000 employees, they estimate that there's a $285,000 per year cost per company, and that's because of the obesity. And we already talked about the indirect and the direct problems with that. And finally, belly fat. Belly fat increases hunger. Why? Well, see, there's this thing called neuropeptide Y, okay? And what happens is when the Zerona, the Z6, the laser that we're going to talk about, changes how the fat leaves the cells, what it does is it metabolically makes it change, and so it reduces the amount of neuropeptide Y. When that happens, then it also helps to reduce the hunger. You know, a lot of people who have obesity issues, just a lot of times it's like, look, I need to eat more. I'm hungry all the time and I can't get enough. Well, that's because the fat wants to eat more. It wants to have more food. Now, the research, the way, remember I told you before a little bit ago, I said, hey, this kind of all happened by a chance. Well, what ended up happening was there was this a liposuction place. I don't say place. It was a liposuction, a place that did liposuction. Okay, a clinic, and there were two doctors there, and the one doctor was more of a research kind of a person than the other one. Anyways, what they did was you know, they would do liposuction, and if you look at the picture to the left, that's pretty much what normal fatty material from a liposuction would look like. And so after the liposuction, you know, it's painful because they're getting in there and shoving things in your body and pulling out fat, damaging nerves and things like that. And so they were using that Zerona laser in order to put on the stomach in order to help reduce the pain from the procedure. Well, what ended up happening was one of the docs said, hey, I wonder if we do this procedure beforehand. If we do it before we do the liposuction, maybe the cells would be stronger, and so there would be less pain. And so what ended up happening was you could see that the one to the right says liquefied fatty material after the laser treatment. So what happened was when they did the laser treatment first and then they did the liposuction, it looked totally different. I mean, it was a completely different picture, and you can see what it looks like on the right. And so what they went to the different places, and you know, everybody found out, oh, hey, this is a great procedure. Well, what ended up happening was they wanted to do some studying on it. So they did a bunch of research, and they were looking at it through an electron microscope. And so what they found was, if you look at the first picture where it says filled adipose cell, fat cell, 0 minutes. If you look at that picture, it looks like, you know, it's a bunch of balloons. Well, after 6 minutes of using the laser, it starts to look different. So what ends up happening is little holes or little pores open up in the fatty cell, and it allows triglycerides and liquefied fat to drain out of the cell. And so you can look at 12 minutes and 18 minutes. When you look at 18 minutes, it kind of looks like a balloon or maybe even a raisin or something that lost all of its, you know, a lot of its content, and it just kind of shrinks and sucks up. So this is just another picture of it. And the question then becomes, well, if all this fat gets liquefied and my fat cells open up holes or pores and they allow that fat to drain out, where does it go? Do I just get all this sloshing around me? Well, so what happens is the fat leaves the cell first, okay? And it goes into the spaces around the cells, okay? And then the triglycerides and the liquefied fat start getting absorbed by the lymphatic system. And if you look down at on the bottom of the screen, you'll see the cardiovascular system, which is your arteries and veins, and you can see what that looks like. Well, you have what's called a lymphatic system, and the lymphatic system pulls and drains from a lot of these extracellular areas. Well, it starts pulling in all that triglycerides and fatty and liquefied fat, and then macrophages, which are in specific called lymph nodes. And lymph nodes, I mean, there's a chain of them in your neck, there's a bunch in your groin, underneath your arm. Those are some major ones. And you know, if you've been sick or had a cold or something like that, and you feel these little lumps, those are called lymph nodes. And so those lymph nodes have macrophages, which start to break down some of these products. And then it allows the breakdown to go into the bloodstream, and the body can use it as fuel. You know, it's like if you work out really hard and you haven't been eating, your body starts breaking down fat. Well, the Zerona kind of makes it easy. It just kind of skips the step of the workout part right in that case. So I want to talk a little bit about the difference between invasive and non-invasive. Okay, there's a lot of different ways to lose weight out there, and we know liposuction is one of them. Okay, when you have liposuction, somebody is shoving that catheter inside of you, not catheter, but oh, I can't think what it's called. But anyways, they're shoving that inside you to pull out the blood, the fat cells. And so, first of all, you know, the person has to be pretty skilled at it in order to make sure that they do it in a manner that is smooth, okay? Because if they don't do it in a good way, then you're gonna have all kinds of ridges and it's not gonna be nice and smooth. So you get rippling and things like that. When they shove that in there, now you've got the cannula. When they shove that cannula in there, now you're gonna have issues with scars, and you can have fibrotic adhesions in those areas. You're going to have bruising, of course, soreness, numbness, because they're damaging nerves in that area, and swelling. And so a lot of times what ends up happening is it could take weeks to months to actually feel better from this because you've had skin and tissue damage. And so the problem is that when they do this type of a procedure, they're actually damaging fat cells and they're killing the fat cells. And I'm going to explain to you why fat cells not being damaged and not being killed is really important. But the average amount of fat that can be removed is somewhere between 2 and 3 liters of fat, okay? That was what you were looking at in that bottle up that we had the slide before. And you're talking somewhere around $9 grand to have this procedure done. So it's not cheap either. The problem is that when you do this, and if you look at the figure A on the left, if that woman had liposuction done to her thighs and her hips, okay, well, there was a lot of cell damage that takes place there. Well, as time goes on and she stops eating well and things happen and she starts getting fat, the fat can't go back to that area because those cells aren't there. So what happens is other areas of the body, mostly the upper abdomen, the shoulders, the triceps, and the arms, and that area, that is where all of the fat accumulates. So now you've got this person who looks thinner below, but looks a lot bigger up top. So everything is kind of out of balance. That's the same thing that happens with something like the next one after this that I'm going to show you. This was an LED body contouring fat reduction. Now, here's the thing with this one. This one doesn't work. And this one is actually the one that Zirconia used as a placebo, okay, or as a control. So what they did was they used the Zerona on some people, and they used the LEDs on some people. And when they looked at that, the different people, it was a double-blind study, so nobody knew what was coming out. The people who got the LEDs didn't lose much of anything at all. However, when they used the Zirconia, there was big changes. This is one called Cool Sculpting. I don't know if anyone's heard this one. This is actually very uncomfortable. It's painful. And you can have pain that can last up to a couple of weeks afterwards. And the next picture, and this one costs about up to $2 grand per treatment area. But look at this. Look at the woman down on the bottom. She's got it, the Cool Sculpting going on her belly. And afterwards, if you look to the right of it, I mean, her belly is all swollen and inflamed. The ones to the right and to the left, you can see that when these people had these done, the Cool Sculpting done, there was damage to the tissue. It's painful and it's bruising. And in fact, the clinical studies show that they only lose about just a little over 1/10 of an inch in 12 weeks. So it really doesn't work. So, you know, that's one of the competitors. But the thing with the Zerona is there's no downtime, there's no pain, so it's, you know, zero, there's none. Why would you want to kill or remove fat cells? Now, I told you before, there's a lot of reasons. Now, fat cells are really important, so you don't want to damage them. It's okay to allow the pour to occur and allow the liquefied fat and triglycerides to come out, but you still want to keep that cell in shape and not damaged, because it's important for immunity, vascular control, coagulation, glucose and lipid metabolism, appetite regulation. We already talked about appetite regulation earlier. Reproduction, angiogenesis. That means making new arteries and making new blood vessels. Fibrinolysis. That's getting rid of fibrin in blood clots and things like that. So fat cells are really important for us. So we don't want to damage or kill them. We want to just be able to allow them to drain so that our bodies can get thin. Now, with the Zerona, what they found is they did 3 times a week for 2 weeks. And there's 4 studies that have been done, and I'll show you in a second here, but 3 times a week for 2 weeks. And they found that there was a 3.72 inch loss. Okay. There's no side effects, no pain, no downtime. And it didn't change any of the fat cell properties. So it allowed them to shrink or shrivel, but it didn't damage them in any ways. So here's the studies that were done. The first one was done in 2010 for the waist, hips, and thighs. There was a 3.5 inch loss average, okay? When they did it again in 2015, there was a 3.72 loss. Now, here's one thing I want to tell you though. When they did these studies, they were not allowed in any way to tell people to change their diet, to drink more water, to exercise. They were not allowed to tell them anything. All they did was come get the laser put on them and they left. That's it. In 2015, they also did a study where they had it done once a week, and they found that over a six visit period of time, there was a 6.22 inch loss on average. So the big deal here is that with the Zerona, there's no pain, there's no downtime, there's no side effects, there's no anesthesia. It's convenient, it's easy, it's measurable. The average patient loses anywhere from 3.5 to 11 inches, and that's just on a short 6 visit time limit, okay? So what they've also done is they've done other, not studies, but clinical trials where people have gone in more to see how much would change. So this is one of the guys that I was talking to his doc, and this guy, Mando, he was pretty heavy. He was over 300 pounds, and his triglycerides after the treatment, I can't remember how many times he did it, but he dropped over 20 pounds. His triglycerides dropped from 2,086 to 160. I mean, that's huge. His cholesterol dropped 127 points. His good cholesterol increased from 17 to 35, which still isn't high enough, but that's a nice change. His his fasting glucose or his sugar levels dropped from 305 down to 117. Still not where he needs to be, but way, way better. His hemoglobin A1C, another way to measure diabetes, dropped from a 10.7 to a 7. Now we want to get him under a 6, but hey, huge change in a short period of time. Liver enzymes, the ALT should be somewhere under 30, and it went from 46 down to, the ALT went from 99 to 57. The AST dropped from 46 to 32. Again, both of those are telling you about the health of your liver, whether your liver is damaged and what's going on there. So again, this was just a short period of time, and actually his MD told him, whatever you're doing, keep doing it, because there's no way that any medication alone could cause these kinds of changes. So we talked about the problems of obesity, heart, the diabetes, the changes in hunger, all those different things. I'm going to give you one slide here of the benefits. Here's the thing. When you reduce the fat, you're going to decrease inflammation. So that's key. When you reduce inflammation, you reduce pain, you reduce inflammation, you reduce swelling, you move around better. When you move around better, because of less pain and inflammation, then you can exercise better. They've seen drops in cholesterol, like I just told you guys, cholesterol, A1C, the ALT, AST, glucose, HDL going up. So there's been chemical changes that have occurred by using a laser. So the goal then would be to hopefully drop things enough so that you can get off medications. It improves motivation to stick to healthier lifestyle modifications. Look, let's be honest, when you're exercising and nothing's changing, then you're going, well, why am I even bothering doing this? There's no point in it. I might as well just sit here and do nothing or not waste my time because nothing's changing. Well, once you can start seeing changes, now you're more apt to make better lifestyle modifications. It can reduce back and knee pain. How can it reduce back and knee pain? Well, first of all, when you reduce fat, it's going to be less weight, which means your knees can feel better. Second of all, when you have that laser on you, that laser is going into your skin and it's producing better gut health. It's producing better energy in the body. It's enhancing or repairing injured cells everywhere. Remember, this is a red laser, so it operates at 635 nanometers, which means that 630 to 640 is where our cells vibrate at when they're in their healing phase. So the laser is constantly putting out energy, which is a healing phase to help other cells to remodulate up to the healing frequency. We already said that we're not killing any fat cells here and that there's no complications, none, zero, no surgery, and it's cheaper than surgery. So you ask again, why would I use such a laser in my practice? Well, it's because if I can help people lose weight, if I can help people feel better, if I can help people get healthier, that's where my practice is. My job is to help people to physically, biochemically, and emotionally move toward health and towards wellness. We want people to thrive and not just survive. So, want to see some pictures before and after? Let's show you some. This one, again, this is after 2 weeks, 6 visits over 2 weeks. And you can see on the left compared to the right, big change. This is a guy, 30 years old. He lost 8.74 inches, again, 2 weeks. Now, when you look at this one, what I want you to notice is people have asked me, they said, yeah, but if I'm losing fat and it's going away, doesn't my skin get all wrinkly? Well, here's the thing. The laser enhances the body's ability to repair tissue. And so your skin will actually shrink some in order to not have to accommodate that big area. So you will see the pooching changes on the left change to that like on the right because the laser is healing. So it's not just something where they stick a cannula in there and they suck out the fat and now you've got all this extra skin. Your body will actually start to repair itself. This was another one. Here's another one. You can look at the love handles, how much smaller they are. 6 treatments over 3 weeks. I'm sorry, 6 treatments at 3 times a week. This was over a 2-week period of time. This is one, only 4 treatments. This was a lady who wanted to have her double chin removed. And so she came in and there's a huge change right there in the chin. This one only saw 4 treatments over a period of, 4 treatments at 3 times a week. So he wasn't even there that long of a period of time. And you can already see, look at the before and after. There's a huge change in the girth, the wideness and the depth of which the belly protrudes. This is another one who had 6 treatments. She lost 9.75 inches. Another one, 6 treatments at 3 times a week. You can see that the belly is not overhanging. Another one where the love handles and the hips have dramatically reduced. Another one, this lady did 12 treatments, huge changes. This is another guy, 6 treatments over a period of 2 weeks. This lady lost 30 inches. She used, there was 18 treatments, lost over 30 inches. And I think I have one more. Again, look at the difference between, this woman did 15 sessions, but look at the difference from the left before to the right after. I mean, it's a huge, you can see it's the same belly because there's 2 holes where the navel is, it looks like. It's the same person. Huge change. And you can see how the skin has actually tightened up as well. This is another one, a woman who, I don't know how many treatments she had, but again, huge changes. Cellulite is not something, by the way, that this laser is approved for, but oftentimes you see it, okay? And so people want to know, well, what are the chances that I could actually have these same kinds of results? Well, what I'm going to tell you is that if you look at, I'll come back. If you look at the satisfaction was 93%. Okay, when they did these studies, it was a 93%. 56% of it was very satisfied. 20, I think it was what, 56, there was 27% that was satisfied, and then 7% that was not satisfied. So the results are that you have a high chance of being of satisfied or very satisfied. Oh, that I know why this. Here's what I wanted you to understand is that the adjacent cells also lose weight. So if they put if we would put the laser on the thighs and on the hips and the belly, for example, not only will you see weight loss, or I'm sorry, fat loss there, or reduction in fat, the circumferential area, but you'll also see changes otherwise. So they may not even, they're not even, let's say in these studies, they didn't even do any laser on the arms or in the chest, but those areas still lost. And the reason is because cells of our body communicate with each other. They're constantly communicating with each other. And when they communicate, the cells in the belly are telling, hey, here's what's going on here. And so those cells start to lose as well. So you will see change throughout the body when you're putting it on a single area. Now, this laser is the only one that is FDA approved to treat the entire body. So it could be on people who have, chubby ankles, whose arms are just hanging with fat. It can be treated anywhere, not just the hip, the waist, and the thigh. So, it all depends. This is what 5 pounds of fat looks like, okay? That's about a 4-inch loss. And remember, the average weight loss, the average loss of circumference was 3.7 inches. That's almost 4 inches. So 4 inches is about 5 pounds of fat. 4 inches is about 2.7 liters of fat. And a successful liposuction is considered 2 to 3 liters of fat. So let that sink in for a second. And finally, so if I were to do this, how much time does it take? Well, we have a focus group that's starting next week. And what we're looking at is 2 times a week better, is 1 time a week better. There was more weight loss, more circumference lost with once a week, but it was over a longer period of time. And so the treatment, the Zerona treatment, when you get a treatment, it's 20 minutes, and then you flip over and we do 20 minutes on, so 20 minutes on your belly, 20 minutes on your back, and that's it. It's 40 minutes. Key, hydration. You got to drink a lot of water. Why do you have to drink a lot of water? Because all that liquefied fat gets into your lymphatics and you need to flush your system. So at going once a week, what happens is you're flushing your body better than it was when they went 3 times a week, but still, they still lost almost 4 inches in 2 weeks compared to 6 inches in 6 weeks. So we recommend 1 ounce per every 2 ounces of body weight, or half your weight in ounces is what I always say. Highly recommend that you are doing some kind of exercise. After you would get treated here, you would either go on a, which we're going to figure out during this focus group as well, you would either go on a chi machine that is going to cause your legs to go back and forth, which is going to stimulate your lymphatic drainage, or you would go on a rebounder, okay? We could also use a vibration plate, but right now we're going to use the rebounder and we're going to use the chi machine. And finally, it only makes sense that if you're trying to enhance your body, it's a great idea to try and do healthy things, like stay away from pasta, bread, sugars. Try to stay away from, if you're investing in your body, then don't sabotage it with garbage. Don't be drinking all kinds of beer and you know, things that are gonna accumulate fat. So you know, we're not talking about drinking a lot of wine or beer or that kind of stuff. The more you do, the better you'll lose. And again, the thing that we told you is that 3.7 inches in 2 weeks, that was 6 visits, 6.2 inches over 6 weeks. And again, that was 6 visits. A lot of people will need more than 6 visits. 6 visits is great for love handles and things like that, but you know, a lot of people might need more than that depending on their size. So here's what I want to tell you is that I'm going to do another webinar in a month, which will be able to give you more information on how things are going with our focus group and which way we're going. We're going to completely change the room, make it all nice and zen. And anyways, so that's kind of what we're talking about. Now, if anybody has questions, I'm happy to answer them. I'm not going to give a price at this point in time, only because we have not, we haven't put it all together yet. I tell you, it cost me a couple of cars to buy this thing, and the thing is that I want to help people get better. My goal is to help people to enhance their lives, and people who are frustrated with not being able to get rid of a pooch from pregnancy, or love handles that no matter how much they work out, those love handles just don't go away. When you feel better about yourself, you work out more, you eat healthier, you do more. So the goal, again, is to help people to be healthier and get healthier. Can you be a part of the focus group? I wish I could say yes, but that focus group is already set up. And so I can't do that right now. However, there was another question about, do we have to wait a month? Yes, right now, we're not going to actually start our doing it in the office to the general population or to our patients for another month. We just really want to get a good handle on making sure we know what is best with our focus groups. I know there's all kinds of research and a lot of other clinics that I've already talked to on different things that they do, but I kind of want to get my own handle on this, and I want to know exactly what I'm doing. So I will not, I'm not going to just jump in and throw this in and just say, hey, we're doing this until I totally understand everything that's going to enhance as much circumference loss as possible. Can the liquefied fat clog your lymphs when it's draining? So here's the thing. Can it clog? Is it possible? I don't think so. And here's the biggest part of it is if you're drinking plenty of water, if you are exercising, and that may mean just 15 or 20-minute walk a day, or that might mean getting on a chi machine, or getting on the rebounder, or getting on a vibration plate, doing something in order to enhance how well your body is pumping the lymphs, the lymphatic drainage, and pumping the lymphs out into, you know, from this extracellular tissues all the way up into the lymph nodes. You know, it's really important for you to keep your system moving. So you have to keep moving in order to keep your system moving. And the better you move, the better you're going to get rid of the extra fat, the fat and the liquefied fat. And so that's why I don't want to go 3 times a week, because my belief from everything that I've read is that maybe if you're going 3 times a week, you keep liquefying, and you don't have enough time to actually get a lot of that liquefied fat out. And that's why at once a week, they lost more. However, at once a week, it might not be enough to really kickstart some people in, and we might need to do twice a week for a short period of time and then move into a once a week plan. Again, this is a lot of the stuff that I'm talking to other docs about who are doing this. There's not really anybody in this area using this device, so we're pretty much the only one in this area. Okay, yes. So somebody was just looking at referrals for plastic surgery. And again, the nice thing is that it does help heal. Every time we use a laser here, it enhances the body's ability to heal. You know, we've used not this Zerona, but the red laser, which emits the same type of energy at 635 nanometers per second. And by using that on my kids when they've broken a collarbone or broken a leg, and all kinds of patients, they always heal in half the time. Always in half the time. It's crazy. I actually did a research, an abstract paper that I presented. Well, actually, I'm presenting it at the sports symposium. I was supposed to do it in April, but that got canceled. So probably either November this year or April next year. So anybody else have any other questions? Also know that feel free to email me if you have any questions. This is being recorded. Probably a lot of these question and answers at the end will be edited out. I doubt that they'll stay in there, but it'll probably be up on our website tomorrow afternoon. So if there's anybody that you know that might be interested, they're more than welcome to go on to, as I said before, stopcheckchiro.com, click on videos, and it'll be up there some point in time tomorrow afternoon. Again, in a month, I think it's July 29th is a Wednesday, I think, will be the next one that I do, where we're going to go over different pricing and all kinds of packages and things like that. And at that point in time, we're actually going to be making an introductory offer, which will be better than any offer that you'll probably see at any point in time after that. So stay tuned, and thanks for being here. So have a great night, guys.